All right, guys, we have made it to the last PowerPoint for your pre-lecture work for week 2. This part is called delegation. So delegation is actually one of the biggest things you're going to be doing as a nurse. You might have experience with it if you work already in the medical field. So if you're like a CNA, LPN, anything like that. You would know a lot about delegation. So delegation is basically you giving the job that you're supposed to do to somebody else. Well, that's kind of like a vague descriptor. It's not you making someone do your job, but it's so that you have time to do other things. So delegation is when you have a task to do, but you have to complete a different task, so you assign that task to someone else. That is kind of the basics of delegation. So what is delegation? So of course the most formal definition is to transfer responsibility for the performance of an activity, task to another person while remaining accountable for the outcomes. What that means is you are transferring some sort of skill activity to someone else, but you as a person that delegated it are still responsible to make sure that it was completed and that they meet the outcomes of what you have delegated. In nursing, it requires us to critically think and identify which actions can be delegated and which ones cannot. In nursing, it is actually one of the most challenging aspects, especially for new nurses. One, because if you're not used to having to tell someone to do something, then you might find it more challenging when you have to get to that point. As new nurses continue to learn to delegate, they will find some challenges in it, especially because when you are not used to telling someone what to do, but then you also have to make sure that they do it, and then if they don't, you have to kind of question them. So, there is a lot of work when you delegate activities and care for your patients. And I remember this very vividly is when I think I was probably maybe a couple months off of orientation, and I was in UGrad, and I was so scared to ask my techs to do things because I didn't want to feel like I was bossy. And so, I learned that the hard way, that some things weren't being done because later it fell on me, that certain vitals were missed, or certain things like changing the beds when a patient had soiled themselves were missed. Because I was trying to do everything and I would run out of time. So delegation, although can be hard, is probably one of the most helpful things that you will encounter in nursing, because you'll be able to get help from other people. But it's one of those things that you have to get comfortable with. So starting now and getting comfortable with it, so that when you become a nurse and you've passed your NCLEX and you're working in a hospital, you're able to communicate your needs with your PCTs and techs and things like that, because taking care of a patient is a very big team effort and you cannot do it alone. And I did learn that the hard way. So what are some things to consider when delegating? Well, you want to consider the patient's condition, how how complex the activity is. So you won't tell a new tech that is new on the floor to do something that they've never done before. Potential for harm, so maybe it's something that, if not done, can cause more harm. Degree of the problem solving and innovation needed, so if it's something that requires more skill, it might not be something that you want to delegate. The level of interaction required with the patient. So this is a good one because there are certain things, sometimes, I'm trying to think of what the example is. I learned that when my patient had a sitter, not all the sitters on are skilled to do vitals. And so we need to know if we can delegate taking vitals to the sitters. In the facility I used to work for before, some sitters were also PCTs, so they were more capable than doing vitals, doing a lot of things. But there was also sitters that were not trained as PCTs, and they were only trained to do sitting, and so we could not delegate PCT tasks to the sitter. And so that is what that kind of means. So the level of interaction required with the patient. And again, the capabilities of the unlicensed assistive person. So not all UAPs are the same. An example would be some UAPs in the emergency room floors or units can do higher skill things because they're trained to do, such as discontinuing Foley's and drawing blood, are just kind of two examples. And it's not always the same in every unit. The availability of professional staff to accomplish the workload. Well, that's just kind of like our staff available to help. So if we can delegate it to somebody that is more, if we can delegate more complex things to somebody that is at our level, we can do that. But if we don't have the staff, we really need to make sure that we're not overloading the UAP with all our delegations, because, you know, they're not only taking care of my patients, they're taking care of probably 3 or 4 other nurses' patients, so we have to be aware of that. So these are the American Nurse Association principles for delegating care. This is pretty much what we need to do when we're transferring care to other people. So the nursing profession determines the scope of the nursing practice, so that's how we know what we can delegate to other people. The nursing profession defines and supervises the UAPs involved in providing direct nursing care. So most places and even states have exactly what a UAP can and cannot do. So we need to know what we're doing with them, what we're delegating to them, and how to supervise them. The RN is responsible and accountable for the nursing practice. So that is very important to remember, because we will delegate activities, but we have to make sure that the UAP can do it, that it gets completed, and that the outcomes are met. The RN supervises any assistance providing direct patient care. So that just states that we are supervising, so we are making sure that the things are done, that the skills, that the care that we are delegating is completed, and that is completed in a safe manner. Lastly is the purpose of the UAP is to work in a supportive role to the RN. So that is very important because we need to make sure we're not overloading the UAPs. We can't just, if we have time to do things, we do it. If we have to delegate it, then we delegate it. But they're here to support us, but they are not our work slaves or anything like that. We are working as a team and not as two separate entities. All right, so here we have the 5 rights of delegation. So the 5 rights of delegation are basically the rules to have in the back of your head for when you need to delegate a task. So when you're delegating, you want to have the right task. That means that the task itself, the skill, the care that they're going to provide falls within their job description. So that includes written policies from your facility or practice setting, but it also includes what guidelines are out there, with the Nurse Practice Act and things like that, that need to be followed. The right circumstance, well, we need to know if the patient is stable enough to have this task completed. We need to make sure that the task isn't going to make the patient worse. The right person, so that's that we are delegating to the right person, so the right licensed person or UAP that has the appropriate skills to complete the task. So right directions and communication, so they should be very specific to the patient and to the person that's going to complete the task. The person that's going to complete the task must understand the terms and they must agree and accept the activity. The right supervision and evaluation. The licensed person is responsible to monitoring that and make sure that the activity was completed. They would follow up and see and evaluate any patient outcomes if needed. The person that it's delegated to is responsible for communicating information. The licensed person should ensure appropriate documentation is completed when the task is done. So the 5 rights of delegation, like I said, keep it in the back of your head. It's for when you think of something that you need done. Think about who you're telling to finish that skill. One example for me would be having a tech or a PCT place or take vitals. So we know that most PCTs or CNAs are capable of taking vital signs. That is a skill that they learn. That is something that they learn so that they can get their certification to be a CNA. But we also have to make sure that they're doing it correctly. So one example is having a CNA or PCT do vitals on a patient and then they get a high blood pressure reading, and so you have them take it again and they still get that high blood pressure reading, but this patient doesn't have high blood pressure, so something's going on. So it is your responsibility to educate the CNA or the PCT and see if they're maybe performing this task incorrectly. Maybe they're taking a reading incorrectly. Maybe things have changed. Maybe they're using a different machine that they're not familiar with. So it's things like that that you're responsible for when you're delegating. And then the documentation is important. So if the PCT or the CNA completes a task, but they forget to document it, then it hasn't been done, and you are responsible for that. So, it is quite a, it's very important. I don't know how to say. Delegation is probably one of the biggest, most thing that causes legal troubles, because we sometimes don't want to confront the PCT or the CNA for doing something incorrectly, or sometimes we just don't know that they're not trained, and then we don't ask. And so legally, because we delegated that task, we are responsible for it. So factors to consider before you delegate some tasks or patient care. So the qualifications and capabilities of the UAP, the stability of the patient, again, the complexity of the activity, the potential for harm, the predictability of the outcomes, and the overall context of other patient needs. So qualifications, again, you need to know if you can't just say to a CNA or tech, go insert a Foley at room 210, because you don't know if they're able to do it. You don't know if they have had practice, if they've done it before. The stability of the patient. So if your patient is unstable, you really should probably be the one providing that care, the main person. If it's something that if you're in the room with the patient and the PCT or CNA is helping you, then that's okay, but understand that unstable patients should probably have that one-on-one care with you. The complexity of the activity. So if the PCT or tech hasn't ever done a certain skill, even if it's under their scope of practice, it would be prudent for you to teach them how to do it and make sure you watch them do it before you delegate it so that they can do it independently. The potential for harm, so that goes not delegating anything that shouldn't be done by UAPs, so passing meds and things like that. That is something that you cannot delegate to a UAP, and it can cause a lot of harm, because even as trained and well-educated nurses, there are still medication errors that occur. So you have to be aware that there's always a potential for harm. The predictability of outcomes is, so it's one of those things where you know if the tech completes this task, then the patient will be good. Or if you know that this particular tech is maybe not so good at that delegated task, well, maybe it should be something that should not be delegated, or it could be something that is a improvement or teaching moment for the UAP. And then the overall context of other patient needs. Well, this one is very important because it goes back to how busy our UAPs are. If the UAP is incredibly busy, we are not going to give them more tasks, because that would just be too much too much work for them, and we already don't want to overload them when in real life, unfortunately, they're already super overloaded with care. Delegation is a huge safety issue. So just remember, nurses, us as nurses, so when you guys become nurses, you will be responsible for minimizing the risk of harm to patients and providers through both system effective and individual performances. So you want to be sure when you delegate something that the UAP is prepared to safely assume that function, and that your State Nursing Practice Act and facility policies approve of this delegation. So this is very important because a lot of things are very facility specific, but you also have to remember Nurse Practice Act. So each state has their own, and they will have their rules and regulations on what things can and cannot be delegated. So those are very important, and it's kind of like reading that fine print. It is a huge, huge safety concern. So those 5 rights are there for you to remember so that you're doing the safest for your patient. All right, we've reached the end of that PowerPoint, so I will see you guys on lecture day. Come prepared. All right.